It has been widely reported that the health issuers are building increases into the 2011 rates to cover the Obamacare insurance mandates. Examples: no patient costs for preventative care, coverage of adult children through the age of 26, no limits on lifetime coverage, etc. If elected or re-elected, what will you do in response to the events, and what do you believe should happen to Obamacare in the next Congress? Mr. Carlson.
Okay, that is a very major question. I can tell you I've read the House Resolution 5808. I haven't read it all through, but I'm not intending to vote for it. That is to establish the public option in Obamacare. It's already been introduced. It's got 120 representatives from the Democrat Party already sponsoring it. And I think that's a very bad idea. Now, what I would do, first of all, I want to tell you, the goal here is to save lives, is not to cut off health care to anybody, but is to put in place a system that actually is constitutional and makes sense. And so what I would do is to immediately call for its total repeal. I would put together a coalition of people who would put something better together. Now, Teresa says that we can't repeal it because Obama will veto it. What I'm saying is we've got to get that Tea Party caucus, we've got to get the leadership there and put something that's targeted. I want to reduce health disparities, and I want to give something to Obama that he cannot refuse because it's going to be passed anyway. So I don't think that it's true that we can't repeal it. And then we would reform it, put in real reforms, the things that there's a broad consensus already between Republicans, Democrats, and Independents.
Ms. Collette.
The Patient Affordability Care Act was passed on two premises, and Representative McCollum promoted it on that basis. Number one, that it would provide health care for the uninsured in the United States. And number two, that we had to get health care costs under control, particularly for business people. The simple fact is, its enactment has proven, as Nancy Pelosi told us, they passed it and now we're finding out what's in it, that there will be 19 million uninsured in 2019 after Obamacare goes into full effect. So they failed on their first initiative. The second is getting health care costs under control. And the Office of Medicare and Medicaid has already said that, in fact, we're going to see significant rises under the Obamacare positions. So they failed to get health care costs under control. The very reasons that they passed this bill are the reasons that it is failing. It's not just insurers. We have local employers here. Medtronic told us that it was going to have to lay off 1,000 employees in order to comply. 3M told us it was going to cost $90 million to comply. The simple fact is it has not stopped healthcare costs from rising. It has increased healthcare costs.
Thank you. Representative McCollum.
Well, I'm very proud of my vote to move healthcare forward in America. Bankruptcy for middle-class families. The largest reason why most middle-class families found themselves filing for bankruptcy was healthcare. People who found themselves in the middle of cancer treatment with a cap on how much money was going to be spent on their chemotherapy. That's gone under this bill. I talked to a small businessman just the other night. He has epilepsy. He joined a small business firm, and he said, I don't know if you're going to want to insure me. I'm going to make your rates go up. But the small business owner insured him anyways because it was the right thing to do. This piece of legislation that I voted for is going to make pre-existing conditions not be used against you when you go to apply for health care. It's going to keep middle-class families from falling into bankruptcy. And for the first time ever, for those employers who have worked so hard to provide access for health care, it's going to help them by paying up to 50% of their costs in the year 2014. We're scaling it up starting this year. I'm very proud of that vote.
Thank you.